You're listening to Maximum Medicine Radio with host Doc Martin. Stay tuned in or call in. You won't want to miss what's happening next. How do you step into your maximum potential? How do you connect your spiritual drive with your physical path? Stick around as Doc Martin takes listeners on a journey through the seen and unseen, the accepted and the unbelievable. Get ready to meet the maximum you the world needs on Maximum Medicine Radio with Doc Martin now. Hi, everybody. Welcome. I'm Doc Martin, Maximum Medicine. And you know how this whole thing about maximum medicine for me and what my shows are almost always about are about the power that you can get in your health through linking up with spirit. And my guest tonight, he really walks bringing spirit into the world, which is one of the things I love about what I've learned about him. Dr. Michael Shea, he's a doctorate in somatic psychology. He's been a teacher. He's a founding member of the Board of Biodynamic Craniosacral Therapy. And what I hope he'll tell us about that's very interesting is he was a student of the Dalai Lama and an apprentice of a medicine man in the Navajo tradition. So he brings, my thing is the indigenous, they walked with spirit informing them every moment of their life. And their medicine, they healed without prescriptions, without blood tests, without x-rays. And I believe they did it through their connection, their consciousness to the universal field. So we'll see what Mike thinks about that ideas tonight. But anyway, welcome, Michael. Thank you so much for being here tonight.
Sharon, thank you. And I actually like all your ideas, and I appreciate that introduction. So thank you so much.
So we have so many ideas to talk about tonight, but you are in the unique position of having studied with the Dalai Lama, and that directed your sort of your focus in your therapy. Can you talk about that a little?
Well, I think to start off with, just historically, I came out of the military with a pretty severe disability. I now have a 100% service-related disability. So, and it's that Vietnam era, I was in a killing field. And when I came out of the military, I was a mess and nothing was known about PTSD. But with the terrorist experience that I was in, it caused me to turn inward. And it actually forced me to turn inward. And back in the 70s in the United States, what was available was Hatha yoga. And then I got into Iyengar yoga. And then I lived in an ashram, a Kundalini yoga ashram. Mm-hmm. And then I studied transcendental meditation. And then I knew that I needed to do some outer work. I needed to have a job. So I got a job and I went to school as a massage therapist and went on to become a Rolfer at the Rolf Institute. And so I had to balance the internal work with the external work of learning how to become a healer, so to speak, or at least, aim in that particular direction. When I was in Boulder and I was in the middle of my manual therapy career, I blew a disc in my neck, and overnight I lost my ability to put pressure with my arms. And that's when I went back to school. And I got a master's degree in contemplative psychotherapy at Naropa University, and it's a Buddhist university. Mm-hmm. And I went through a lot of steps to convert, so to speak, to Buddhism with refuge vow and bodhisattva vow. So I began learning an in-depth and having an in-depth understanding of a contemplative approach, a meditative approach, coming directly through Tibetan Buddhism. And it was through that foundation then that I was introduced to various high-level teachers, and settled on the Dalai Lama as my principal teacher.
Well, it's interesting to take something as horrific as war, suffering to the ultimate, and a system. Well, we won't get too political here, but a system where we encourage people to go out and be ready to do harm to others. And that kind of trauma to your psyche, much less the trauma of being injured or looking at people being injured, and then being able to find the peace to be able to enter into a path of service. That's a big step. That's a big step. I have to just really honor you for that hard work. That was
Well,
hard work.
well, Sharon, thank you for that. I would agree with you that it's hard work. Had I known when I went to massage school in
Mhm.
1976 on the GI Bill what I was about to go through for the next 50 years of my life, I might have just done a U-turn and become a bus driver and said, I've done,
Uh-huh.
no, I'm not going in that direction. But
Uh-huh.
here I am, I've done tons of therapy. So when I realized with the body work that I had some challenges, that I was getting anxious, I had this fear. And what was available at the time was Gestalt therapy. And I started studying Gestalt therapy. And then from Gestalt therapy, learning these other various like neurolinguistic programming, and then going to Naropa and learning contemplative psychotherapy. And then also at that phase after Naropa, learning that PTSD was what the diagnosis du jour actually was. And so then I entered into all the PTSD therapies. So I feel like one therapist said, "Well, Michael, you like to roll the dice with your psyche, because I love therapy now. I embrace it,
Mhm.
and I also have a life, where there is suffering that I experience, and I know how to work with my suffering, and I know where to get the help I need now, and that's taken a long time."
How do you think, what was a key factor if you had a disc injury in your neck, taking out the strength in your arms? How did you how did you heal that?
Well, at the physical level, I was in chronic pain for 3 years. So, and it was exactly the 3 years that it took to do a master's degree in psychology. So at Naropa, I was in therapy 3 times a week. We were in individual therapy, and we were in 2 group therapy settings that we were mandated. I had therapy 3 times a week for 3 years. And I finally started to settle. And by the end of the program, I got a job as a psychotherapist at Boulder Memorial Hospital, and I was being paid $12.41 an hour, but my arm was feeling better, and I was making $70 an hour going back to manual therapy. And I said, I think I'll go back to manual therapy and apply what I've learned around
Mhm.
contemplation to healing.
Mhm. There is and I'd like you to talk about this because you really have deepened into this. There is a space where the practitioner and the client and spirit meet. Sometimes I kind of refer to it as that sweet spot, but it's that deepened, that when you actually have to deepen into it and meet potential and meet spirits. I call it, and we can talk more about this because I might not even use language you would agree with, but there's a original template that our cells, a textbook they walk to, a guide that they follow. And that to me, this is in my thinking, when you have an illness, it's like a glitch happened, that original programming and that original flow and desire to be well is interrupted. And when you're in that in contemplative space of the practitioner, the client, and I say you have to bring spirit into it, something magical happens if you can really deepen and allow that original template to restore itself. Now, I might not be using language you would agree with, and because I kind of made it up in my head, but can you talk to that because being a Buddhist, you have sat in deep spaces. Being in therapy 3 times a week for 3 years, you know yourself. But isn't there magic in that coming together?
For me, the magic is in the heart. And I completely agree with what you're saying. And in that dimension, it's where do you place your attention? How do you place your attention so that your perception can synchronize with that deep spiritual space? And there is a physical location that all the Eastern traditions, or most of them, agree on, and it's located in the human heart. And so the focus in my work for the last 12 or 15 years, and that's why I study with the Dalai Lama, because he insisted that if you're going to be a student, you need to set up an institute for the study of the human heart. And that's actually what I've done. So what I do in my classes and what I do in my own personal work and in the terms of my own contemplative work is I got to keep this simple for the audience. But number one, I find my heartbeat. It starts with finding your heartbeat. Sharon, the research literature on just consciously sensing your heartbeat is outstanding. It builds empathy. It's the foundation for compassion. And all you have to do is feel your heartbeat and be able to listen to your heartbeat. And from that, I begin working with different visualizations within the Buddhist tradition of visualizing the heart as being the 5 rainbow colors, and then finally getting to a very clear light essence of spirit located in the center of the heart. Not necessarily the heart chakra, although some people would like to say that. That's okay. I like to stay with the physical heart because that's where the heart chakra is located as well. So that's where I place my perception and how I train my attention and my students' attention in order to feel the coalescing of that universal energy as it meets through the various places in our body, the chakras, the acupuncture points, but it all comes to the heart. And so that's where the focus is in my work and the Dalai Lama's work.
You made me think of 2 things. I'll freely admit it here. I've been seriously type A in my life and worry about things and look ahead and see what can I plan to make sure something doesn't go off the cliff over there. And what I found this couple years ago, and it wasn't I didn't discover anything myself. It's well known, but the Heart Math Institute and a simple biofeedback little thing, a little probe on your earlobe to feel your pulse, and you just sit and breathe, and you get into that variable heart rate place, which has neurologic correlates. But I found myself really peaceful. It's a really peaceful place when you just drop down into that basic pulse. And the other thought I had is you might remember from back, I believe it was 80s for sure, maybe 70s, Drunvalo Melchizedek, spiritual teacher, trained with the Hopi.
Yeah.
And he did the flower of life in the Merkaba. He was very tuned into the Egyptian traditions. But he had the meditation of going to the sacred space of the heart. And it's a magic place. And if for me in my work, when I don't always do shamanic client work, but if I go in my meditations to that space and I sit, the wisdom that comes to me is so much greater and deeper than if I'm like, somewhere else in my body. It's a magic place, isn't it?
Yeah. Yeah. Like yourself, I also started with heart math, and I also had one of those gizmos on my ear. And one of the things I love the sense of heart math because it's you're trying to tune into a coherence. You have to allow what's happening in your life to become coherent, to settle down, so that the coherency that the heart has, the coherency to synchronize with the universal forces, is present and can become present, but it's always there. And one of the things that I learned from heart math, like yourself, and you alluded to it, is the breath work. There's breath work, there's slowing the breath down, becoming mindful of your breath, and that really helps settle the heart. You have to know when your heart is accelerated, and you have to know when to slow it down. It's not enough just to, from the spiritual point of view, to know your heart, but you have to know when it speeds up, and you got to know how to slow it down. And that's usually through the breath or through attentional techniques, or through just getting out into nature. And then there are those techniques that take you deeper into that spiritual place, the so-called fifth chamber of the heart that Steiner liked to say.
I don't know that. Tell me more. What is the fifth chamber of the heart?
Well, Rudolf Steiner, the great teacher from the turn of the last century in Germany, and he started anthroposophical medicine. So, and there's an anthroposophical medical center, I think, in Philadelphia, where you are. But he likened the spiritual essence in the heart to the fifth chamber of the heart. And so he likened that because the honeybee, if you look at this on Google, you see that honeybees have a fifth chamber. So he said, well, we have this fifth chamber, but it's this where the spiritual essence is. And actually, I've shown in many presentations, because I'm an academic embryologist, that there is a moment in embryology where there is a fifth chamber. So we have that innate, and it's actually an open space in the embryo. So, and that's where the spiritual essence, Shen or breath of life or Holy Spirit, whatever metaphor we want to use, but that's where the home of the spiritual essence is. And it's in the center of the heart.
So, embryologically, is that when the heart is now an adult heart, does by any chance is that hole, that fifth chamber, end up on the back of the heart?
Yes, I would say right now you could say that it automatically shifts. That's just an osteopathic term, but there is an automatic shifting because in growth and development, you're constantly shifting the fulcrum for growth and development. So that middle fulcrum there is often spoken of to be located between the posterior heart and the pericardium. And it's also a source where the Vayu, the primary all-pervasive wind of Ayurveda and Tibetan medicine emanates from. So it's right from the back of the heart, in the back of the physical heart in the adult. That's where it ends up. So beautiful, Sharon.
Well, it's interesting because in a meditation, when this was 20 years ago, when Drunvalo was saying, find the tiny space of the heart, I just knew that this magic place was at the back of the heart. Now, I don't have any Ayurvedic or Eastern teaching. It just sort of resonated that that's where it was. So that's pretty neat. I like that.
Yeah, Sharon, I think everyone can come to that naturally. It's like, I just have this aptitude for reading a lot of books and studying, but when I have heart patients in my classes, I always direct them to feel their heartbeat because there's a lot of fear that, that there might, they've got a heart condition, they might have a heart attack. And I always tell them to place their attention in the back of the heart. That's the safest place to put your attention. And I have had these patients or the students, all of them universally say that has been so, so helpful.
It's a magic place.
Yep.
Yeah. I mean, I've sensed that for years just from sensing, not because I really knew anything. But so one of the things that, and in your book, the biodynamics of the immune system, see if I can do this with the Zoom camera. Maybe not, maybe not. Balancing the energies of the body with the cosmos. You are very, very well trained and knowledgeable about embryology. And not just that as an academic knowledge, it has informed, to me, tell me if I'm right or not, it has informed your understanding of the flow of lymph, of your craniosacral work, tell me, how did you end up an embryologist when you're a psychologist, a deep meditator, a body worker? How does embryology, which is very, I mean, step by step, it's a serious academic thing to learn. How did you come upon that?
Well, you mentioned at the beginning that my primary focus when I teach is the craniosacral therapy. And basically in my doctoral work, I had heard that, craniosacral therapy comes from the tradition of osteopathy. So, and then from osteopathy, it was developed, the cranial technique. And then at the end of the life of one of the founder, Dr. Sutherland, in the late 40s, he said that we had to have respect and reverence for what was happening in the body. And his followers thought that that meant moving towards a deeper understanding of the source. So embryology, how was the human body formed? And so biodynamic osteopathy became, and we have borrowed that term biodynamic because it is a embryological term. There are two branches of scientific embryology: the biochemistry, the metabolic study, and an equally valid scientific study of what's called biodynamics, the study of the forces that are present, that are in the movements that the embryo is making. And so the osteopaths developed a system of manual therapy around these forces and these movements. And so in my doctoral work, I studied with the lead osteopath of all the osteopaths that knew embryology, and he got me to study embryology. And so every time we'd have an interview, he'd say, "Did you find your embryo? Did you find your embryo?" And I'll tell you, Sharon, there was a point at which, and I thought it meant I had to read another book on embryology. And I'm looking at the pictures. I'm on a plane one time, and I'm looking at the most beautiful pictures of me, when I was this big. And I started weeping and crying. I was just so powerful. And when I told him that experience, he said, "You found your embryo because you found love for yourself, which is embedded within the heart and within those early forces of the embryo."
Yeah, I found in a more academic or medical approach, the idea that cells, as the embryo's growing, are traveling and moving, and then they somehow are told where to go, and they end up in this place, and all of a sudden they blossom into something miraculous, like you're moving along, and then all of a sudden you're a nerve cell, or you're moving along. I mean, it's just amazing, isn't it?
Well, and I don't want to oversimplify it because it really is a mystery, but when I teach it, I try to get it into people's hands. There's 8 fundamental motions that the embryo makes, and so they're still present in the adult. So I teach people how to feel those motions, and so they have to be able to feel that shaping with their hands. And that shaping means that in the embryo, every structure has a particular shape, a cellular shape. It just depends on the shape. So some cells become oblong, and some become twisted, and some become more round. And they have then their final fate of being a bone or a muscle or a neuron or whatever. So it's just the shape, and it's the movement and the force that's being placed on the cells. And the biochemistry. I can't leave that out, or some embryologists would get upset with me.
So let's walk that now into you as a craniosacral therapist. And I don't know very much, so you please teach me at least enough so I'm not too, that I can be more educated. You're feeling a flow. Is that accurate?
That's correct.
Is it an energetic flow, or is it actually a corollary of the lymph system, or both?
At this point, I mean, we could separate it out, but it's really both. I mean, it's the lymph, but originally craniosacral therapy was looking at the flow of cerebrospinal fluid.
Okay. Okay.
And then being able to feel how that fluid moves in the brain and the spinal cord. But that fluid comes from the blood. So then osteopaths became good at sensing how the blood moves and the lymph, because the lymph is associated with the blood embryonically. They both come from the same source. So these movements they have their embryonic origins. So it gets down to sensing that flow, and how it moves, and therefore you can feel how it's blocked. And if you feel how it's blocked, then you have a tool, or you might have a tool that you can unblock it if that's what's called for in the therapeutic moment with that client.
Yeah, I like that. And what do you think? Was it your osteopathic actual body work teaching, and probably a combo of everything, but to you're actually sensing both with your physical senses, but I'm going to say that you also are incredibly intuitive, and through your meditation training, you can sense energetically. Is that accurate?
Yes. Yes.
And then if you want to, so take me into a primary healing process that you might use. What are you thinking or intending? You feel that there's no flow. There's a blockage of flow. You feel that both by feeling the craniosacral, by sensing the body's energy, and you talk about in your book the primary respiration.
Right.
Then you sense that there's a blockage. Do you know where in the body that is?
Well, let me, sometimes yes, sometimes
Okay.
no. What Dr. Sutherland said, and this is, when you're tuned into that subtle, it's called primary respiration, and that's the motivating force, that's the life force that moves the blood and moves everything. Dr. Sutherland said that you follow that because it has the intelligence to choose what it wants to fix in the body. It's not up to the therapist. So the work is about the perception of the slow tide of primary respiration. So we have to learn at a contemplative level how to slow down our own mind and how to synchronize with that slow movement. So there are techniques for doing that. The eyes looking at the horizon and feeling the subtle movement going back and forth. Or you can tune into your heart, because the heart math is really clear. The heart field is 15 feet out. So when I'm sitting with a client, I'm sitting within their heart field, they're sitting within mine. I put my attention in the back of my heart, and primary respiration has a source there for coming out. And I actually feel primary respiration moving me and my heart back and forth with the client. So the initial phases of the therapy are about settling into the movement and just waiting, watching the movement, and just wondering. That's the intention to begin with. And then there's a fundamental shift, and there's a fundamental shift where something from the background comes forward into your perception, and it's stillness. It's non-thought. There's a gap. There's a gap in our thinking, and all of a sudden there's this openness and there's this open awareness. And so in osteopathy, they call it a still point or
Mhm.
dynamic stillness. So it's within that dynamic stillness that it's felt that the client has reached their original cosmological origin or their embryonic origin, because there's a stillness, there's a void space. And so the instructions are, don't do anything, just settle back and relax and wait until that stillness resolves itself back into the primary motion. So that's the basic plan with a therapeutic intention.
So you're giving structure and detail to a process that I intuited, and I didn't have any language for it because I don't have your talents, but that to be, and again, I'll say it in my words, and I think you've given the actual details of it, to hit that space, that resonant space of the practitioner and client with the opening that lets spirit come through. And then I had this knowledge or this sense that then the original template takes over. And it's back to the beginning. It's what existed in its purest form, the way our bodies were meant to be. And that takes over and recodes, is that's not writes over, right, overrides the glitch.
Recalibrates.
So I've been thinking about this process in its most vague, I guess. My ideas were very big and didn't have the detail. And you've just taught me that's happening, because if you were hit that space at the primary respiration, then it's informing everything else back to the beginning, back to either the spiritual design for the human form or the embryologic design for the biologic form, and let it just come back, recalibrating back to the way it should be.
Right. And then
I want to hear more. Okay.
And then, so we're going through the early stages. We work our way through these stages to get to that. John Tarrant once said in a book called The Light Inside the Dark, spirit is not given in a situation, it's uncovered by the quality of our attention. So the quality of our attention brings us along this path to the stillness and to the wind of primary respiration as a wisdom wind. And we can begin to see and appreciate and wonder how this functions in the human body with primary respiration as this wisdom wind, and then this dynamic stillness that has an essence of essential voidness, like the beginning of the universe. And then what happens is quite beautiful, and it is the third phase happens, and it's color and light. We begin to see how all the cells of the body emit photons. And we begin to see how the heart actually emits the most photons, if you look at the research. And so when we've heard this, I know we're beings of light, but you can see it. We have to be able to see that. So what I do is I teach my students to close their eyes, to roll their eyes up to their forehead and stimulate the optic chiasm. And you'll see a little bit of a spark of a light. And then you want to begin to visualize or imagine different colors in your heart, like I said earlier. And that begins to not only purify and recalibrate, but also add potency for the person to be reignited, in their life destiny and their life path through the power of the light, whether it's the Holy Spirit or Shen, whatever one might call it. It's beautiful. I just use clear light is what is called in Tibetan Buddhism, just clear light and then rainbow light. So that's what I use, clear light and rainbow light.
I love the corollary, because in my teachings, in my learnings in shamanic training, the Peruvian tradition, we were taught about the rainbow tapestry of the energy body being this rainbow waterfall that came down all around us. And one of the journeys that I've used in clients that felt very simplistic, but when I would do it, people had this really amazing recalibration. And I would have them visualize going through all the colors of the rainbow and flood their field with the red, the red of a cardinal, the red of a rose, the red, and then the orange. And that works.
It
I mean,
sure does.
I knew that it felt good to do, but now you're explaining to me the details of why it works. So thank you.
Well, Sharon, it's important clinically because I also have done a lot of research and we work with a medical model in Europe, Biomedicine International. And we have so many clients now with long COVID or
Oh,
vaccine side effects and so forth.
mm,
And the long COVID, because it happened to me, and I was diagnosed with pulmonary hypertension, which I don't have. But the way I healed that and the way I'm helping and teaching people to heal it is to visualize each chamber of the heart as one of the rainbow colors. And then to start seeing the clear light underneath that radiating those colors, healing each chamber of the heart, because it's the chambers of the heart that got damaged in long COVID and in the last 3 or 4 years. Lots of other ways we've damaged our heart in the last three or four
right, right.
years. But let's just talk about long COVID and vaccine side effects. So visualizing each chamber of the heart as a different color, it's been amazing. I even got an email today from someone with serious pulmonary hypertension, and it's been reduced by 60% from that visualization process.
I love that. I'm just going to throw in a connection here for the listeners. A couple of shows back, I interviewed a naturopath who founded a company out of Toronto called Kananda, and he markets an endocannabinoid. Um, it's a plant terpene called beta caryophyllene, CB2. Cannabis carries it, but it is not the psychoactive part of cannabis. And I have taken that compound, and I have several patients who have young women who have chronic fatigue that I believe they have long COVID. No tests are showing up. It's one of those just complete malaise. And this beta caryophyllene they've gone to pulmonologists and sleep experts and were put on stimulants to keep them awake during the day, and just not a fun thing to do. But they've started this CB2 marketed by Kananda, and they have starting to regain and restore their energy. And it's interesting because I believe that this has more scientific value than we actually know. And I believe if I think about it spiritually, it's um, plant medicine from a plant,
Mm-hmm.
it's in
Mm-hmm.
pepper, it's in cloves, it's in many things, but it acts on endocannabinoid receptors, antioxidant, anti-inflammatory, anti-neurodegenerative, anti-anxiety. And it's really, I've just watched the healing of what I believe is chronic fatigue and long COVID from a different approach, much different from what you're talking about. But I was just struck by, I do think that um, effects both of COVID and that immune stimulation we had several years ago. And I don't think it's over yet. I think we have more bugs coming our way.
Oh, we
Um,
have some more bugs coming our way, and
mhm,
again, I don't want to claim that these visualizations and the conversation that it can be limited to that or just exclusively
mhm.
healing from that. We have to have multiple factors. I also have supplementation. Supplementation is essential at this point because we are so depleted, and our blood is so depleted. That's why the heart meridian is paired with small intestine. And in the European docs we study with saying, all these disorders, they're disorders of the small intestine because we're not building good, healthy blood with the diets that we're having. So we've got to have good supplementation. We've got to repair, with our food and our diet, and we've got to have a contemplative practice that works for us and allow the spiritual integration to occur at every level, at every level.
When you bring it back to more on the physical, the damage that we've done to our microbiome um, just in that small intestine, that's just, it's criminal. I mean, do we need antibiotics? Yeah, when somebody's got a bad pneumonia, you need an antibiotic. But if you don't have the time to go to a real healer, but we've ruined and our food source. I mean, we could go on for a long time about this, but I mean,
Right.
there are so many, and I don't know a lot about testing for the things that many naturopaths do and testing for heavy metals and this and that. But I know this, that we test a lot for simple things like magnesium and vitamin B12, and people are deficient. People are deficient in basic stuff. It's really kind of scary, isn't it? Ugh.
Well, physically, we're being told, by the alternative folks, and this is, I'm preaching to the choir too. We have to detoxify because we're so toxic with what we've eaten in our body, and the mercury, all this stuff, the heavy metal. But Sharon, it's the same thing with spirituality. At high levels in Buddhism, it's about purification. The first thing you have to do is purify your mind. You've got to purify the emotional junk that is blocking you. And we have to purify what's called the cognitive obscurations. But we have all these wild views and these wild thoughts. They have to be purified in order to move more fully into the spiritual domain of non-duality, open awareness, and so forth, and direct access to clear light. We have innately within us the ability for constant mystical experience. We don't need any intermediary. It's already located within us. And that's why the purification at the spiritual level is necessary, and detoxification at the physical level is absolutely essential. It's the same thing.
So many times people have said, quit watching the news. It is really true. And I'll just reiterate it, that all of these thought forms that we let ourselves entertain, and especially with our crazy politics and the us versus them and all that negativity, that those thought forms are toxic. And you said something else and I'd like you to speak a little bit more to this because I preach this all the time, but you have a deeper understanding so you can educate people better. Go out in nature, you said. Tell me energetically, spiritually, space of your heart, how do you sense or see the value of nature?
Well, I mean, we could talk about the research literature. I mean, we know the research is so clear that just taking a walk in nature, unfocuses our attention and recalibrates the brain and so forth. But I think from a healing perspective and from a contemplative perspective, the contemplative neuroscience now that's really, really coming to the foreground, it is about turning inward, learning how to turn inward and dealing with our fears, with our suffering, with whatever it is that's coming up for us, and having the skills to do that. But because, for instance, I've been doing a lot of consultations on cancer, I mean, 2 more this week, and it's you get into this diagnosis shock. And you can't just sit and say, well, let's sit down and we'll pray or we'll turn inward, because they're in a state of overwhelm. So it's knowing that if you can't turn inward, you've got to be able to turn outward. And you've studied shamanism, I've studied it. That network of the original medicine on this planet was all based on the natural world. And everything in the natural world is capable of healing you. Every single plant, every single thing we see. And it's in the world of nature. Like before this particular talk, I went down to the beach because I'm a block away from the beach, and I did a Qigong practice, and I just stared at the horizon and the clouds for like 20 minutes until my mind could stop. And I go into a state of awe. It's called The New Science of Awe. I bought this book and I'm like, yes, that's it. To be able to feel awe, it's like, oh my God, this is so much bigger. And so the natural world is really critical in helping that recalibration. that we're talking about. Really, really valuable because it's medicine. People have to understand that the natural world is medicine and these plants are medicine. What we're looking at is medicine.
And that moment of awe when you realize you are part of something really big, and when you can when your awareness can go outside of yourself into that universal collective domain and really get the most incredible awe, and that lifts you out of yourself, and you can find those moments of unity.
Yes.
And
Yes.
yeah, I love that. Um, Michael, we have a couple of minutes left. Is there anything else you want the listeners to know? And then if you'd give them a clue about what's coming in your new book, um, so they
Well,
can be
thank you.
ready.
I think we've covered a lot of territory, but I think what I've been focusing on, because of the world we live in, and you mentioned social media. I talk about that a lot, how destructive that is to our mind and emotions. But from a contemplative point of view, we have to learn how to turn inwards and settle and really recognize and relax within that settled place. And what we've talked about, for the last couple of minutes is that looking inside, that settling inside is in the heart. In the heart, it's in the heartbeat, it's in the breath, the quality of the breath, and it's in the quality of movement, and it's in the quality of the ability to visualize color, especially at night, because I wear a blackout eye mask, and the best time is really at night when you wake up and I have this blackout eye mask and I just start visualizing colors in my heart. That's the easiest thing to do. And I think that's the main focus of my new book, the biodynamic heart, somatic compassion practices for a clear and vital heart. But the practices, Sharon, are also associated with how to become your own mystic, how to become your own shaman. This is innate. This is built within us, and we just have to uncover it, and it's located in the heart. And it's a different journey for everyone because we all have our own style of suffering. I got mine. We all have our own style that really works us. And so within that context, I think it's very, very important, once again, that the focus be on the human heart. The Chinese philosopher Mencius once said, people, when they lose their cat and their dog, will spend days and weeks. They'll put up signs all over the neighborhood, everywhere for their lost dog or cat. But when they lose their heart, they don't even think to look for it. And I think we're in a culture that's lost their heart. And it's as simple as coming back to our heartbeat. And it's as simple as reducing the amount of thoughts that we have, the negativity that we have. That's not easy, but you have to have a contemplative practice. So this is the direction of the new book, of describing my own mystical processes that I've had, and how everyone can have that ability because it's in the heart.
Well, I love that because the whole premise of me starting this radio show, gosh, it's 7 years now, was the idea that we have so much power over our health, over our life destiny that exists outside of mainstream medicine, exists outside of what we consider as healing tools, and that returning to what the indigenous knew so well, that we really, and I believe it has to have connection to spirit, but then again, you could say spirit is just the universal field and universal consciousness. But that's what my whole show is about. And I'm so glad you brought it up because it's about reminding us that we have unbelievable power.
We do. And spirit has movement, and spirit has a still point, and spirit has a light and a color associated with it. And these are the three doorways into spirit, in the body, in the heart, in our blood. It's circulating everywhere to every cell in our body.
So say that again. The three doorways are movement.
The slow movement
Okay.
that we
This,
synchronize with slow movement, which means we got to slow down, but there's a slow
okay.
movement happening.
Okay.
That
The
we
still point.
The still point, when we feel that moment of open awareness or awe, because it can happen inside as well as outside, where there's just a pause and a gap and an openness. And there's a wisdom in that openness that we can appreciate if we can notice it. And finally, that we can also begin to wake up and see, literally see inside and outside, the colors associated with the appearance of spirit and how spirit creates reality, first through the colors, then through the solidification of the elements. And well, that's Tibetan medicine I'm teaching. I've studied Tibetan medicine for 50 years. So, but
Well,
that's
you
the
and I are
pathway.
going to have to do another show because that co-creation is a really good topic. That
Yeah.
ability to create your reality. So let's plan ahead to do a show on that. That would be great.
Oh, yeah, absolutely. Absolutely.
So tell the listeners again, if you would, please, the title of your upcoming book.
The title of my upcoming book is called The Biodynamic Heart, Somatic Compassion Practices for a Clear and Vital Heart. And so there's 4 sections in the book. The first section goes over my pediatric practice and my life story and how I learned compassion with infants and children, which was my specialty, infants and children with severe brain disorders. And then from there, I get into the shamanic work and healing work as it's associated with the instinctual level of healing and how to ignite our instincts. And then from there, getting into the skills necessary to be present for our life, for clients, and then finally all the hands-on technique in the last section of the book. And there's a lot of hands-on work because the book is focused on creating a ministry of laying on of hands. This is not just for manual therapists. This is for everyone to learn how to heal with your hands and let your hands become the light that's radiating from the heart through our hands.
I love that. I've loved talking with you. Thank you so much for coming on and teaching everybody. Your depth is incredible. I honor that. And thank you for joining us tonight.
Sharon, thank you. It's a joy. I love being here. Thank you so much.
We're going to do it again because this Tibetan medicine co-creating and stuff is pretty cool. I like that. Yeah. Everybody, I'm Doc Martin with Maximum Medicine. You've had Dr. Michael Shea here. You can find him on sheaheart.com. Is that correct?
Yes, ma'am.
Yep. And his upcoming book, Techniques for Us to Even Do Better, Healing Ourselves and Healing Others. The power we have with those energies coming out of our heart, the photons, the light going out to our fingers, touching, healing. Don't you love it? Anyway, thank you guys for being here. Michael, thank you so much. Good
Pleasure.
night, everybody. Nat, thank you. You've been listening to Maximum Medicine Radio with Doc Martin. Tune in next time while the doc talks health, spirituality, and the impact your beliefs have on every part of who you are, body and soul. Doc Martin unpacks the challenges we face as human beings and teaches callers to open the door between the scientific and the mystical. To learn more about Doc Martin and Maximum Medicine, visit www.sharonmartinmd.com.